And Dr. Bear, what are the treatment options for someone who has plantar fasciitis?
The treatment options really vary. Number one, if I had plantar fasciitis, I always stress the importance of stretching the Achilles tendon. The Achilles tendon is, of course, the calf muscle that eventually turns into the Achilles tendon. The Achilles inserts into the back of the heel bone and then sends these expansion fibers that form this fascia. So really the fascia is an extension of the Achilles tendon. And so when we treat it, number one, I always start with stretching the calf, stretching the Achilles. And there's not a great fascia stretch. They talk about massaging techniques with rolling. Some people say, well, I'm going to freeze a water bottle and roll the water, and that's fine. And sometimes people like manual massage, and I think that's great. But number one to me starts off with stretching of the calf muscle, which is a real simple thing. It can be done at home. It doesn't need to be done for an hour a day. Sometimes 5 or 10 minutes is really adequate. I always look at support when you look at shoes. You know, is the shoe gear, is it supportive? Or are they wearing flip-flops or sandals? Something that's not going to support you as well. Third would be inserts, something to support the arch. When you support the arch, you support the fascia, okay? So that can be very helpful. Sometimes anti-inflammatories can be very effective. Cortisone injections, night splints. A night splint I love for people that say, boy, my first steps when I wake up in the morning are agonizing, and once I get going it loosens up a little bit. Or if I've been sitting eating dinner or watching a television show and I get up, my first steps are terrible. Those are the people that really respond to a night splint, because the night splint doesn't let your foot drop down and let that fascia in the calf shorten. It makes a huge, huge difference. Physical therapy, another really good modality, can be very effective on getting rid of it. Those are the mainstay treatments.